Melvena Scott, and I will be speaking to you in regards to Medicare fraud. Does anyone have any idea what Medicare fraud is about? Yes, ma'am.
I do. I know what it's about. Okay, like some people like scam the healthcare system, like to get like most professionals that work in healthcare, they scam the healthcare system in order to get money that they, like say for instance, if you go visit the doctor at the hospital or whatever, he will like charge you for stuff that you didn't even use, and
exactly.
And they get paid for it, but that's how they scam you.
Exactly. Well, in the past 2 years, well, since President Obama's first election, he made it a point that he was going to stop Medicare fraud. So in the last 2 years, he's implemented a lot of different incentives that go along with his Obamacare Health Reform Act. Some of the examples of fraud is healthcare providers who bill for services not rendered, or suppliers who bill for Medicare, for equipment for Medicare beneficiaries that's not medically necessary. So why should we stop Medicare fraud? Because if we were to stop Medicare fraud, it would stop or help to decrease the cost of health care for individuals that do not have Medicare or Medicaid insurance. The fraud costs families, it costs businesses, it costs the federal government, and anytime something costs the federal government, of course, the people of the country are going to pay for it. We're going to pay for it in higher and increased taxes. The way that we stop this Medicare fraud is, one way is through the Affordable Care Act, which has recovered $10 billion in the last 3 years. This is one of the acts that was that come out of the Obama incentives. He also helped to create the Healthcare Fraud Prevention Enforcement Action Team, which is called HEAT. HEAT is a joint effort between the Department of Justice and the Department of State Health Services. And the bottom line is, if you're a provider and you cheat the government, we're going to come and get you. They also have senior Medicare patrols, where you have seniors that go to like the community, senior community centers during the day when the beneficiaries are there, and they talk to them and educate them on how to look at their bill. Because each Medicare recipient, once something is charged, they do get a bill. And what the patrols do is go out and teach the individuals how to read their bill. Look at, did I go to the doctor on December 15th? If it's a charge on there that says I went to the doctor on December 15th and I was at home watching Young and the Restless or at the community center playing dominoes, then I need to call and report this because there's some fraud. The new rules and sentences that have come down is that if you caught, then you're going to do 20 to 50% more time than they used to charge. They used to charge, say 4 or 5 years in the federal penitentiary. Now it's 20, 30, 40 years. They put it on the same level as interstate drug trafficking because you're cheating the government. So if you decide to open a home health care agency, don't think that you can say, I went to visit Mr. Joe Blow on Monday, Wednesday, Friday from 8 to 12, and you never showed up, you billed and got the money. They're going to catch you. And then you're going to do federal time. And federal time only gives you a 6-month parole. So if you get, they deal in months. If you get 24 months, you're going to do 18, and then you'll have 6 months on parole. And the money that's coming from Medicare, it seems good if it's a lot of people, but it's not worth the time that you're going to spend. What is some of the fallout behind these initiatives being put in place and the task force coming out to organizations is the people that work for the organizations on a lower level. And I'm living through that now at the hospital where I work. We had one individual that was given a lot of power and leeway in the department, and he misused the organization. So now, not only do our patients not have a place to go that are chronic, they suffer with chronic mental illness, they have nowhere to go because we can't accept them right now. The employees, we're down to maybe 20 employees in the building all day, when we were running 100 employees in the building. So there's a lot of fallout when you want to cheat the government. They're gonna come and get you. They're gonna give you long sentences when you call.
I'm concerned.
So don't do it.
Thank you. Thank you very much.